Okay, you can start, Jose. Don't forget to do a presentation for Mr. Victor Ekpo.
Okay. Good afternoon for everyone. Today we have the opportunity to attend a talk by Mr. Victor Ekpo. He will be presenting his topic titled Medical Physicists, Leadership and Innovation in the Fight Against Cancer. Well, Victor Ekpo is the Executive Director of Pink Africa Foundation and Medical Physicist at ASI Ukpo Cancer Centre, Calabar, Nigeria, utilizing radiation in the treatment of cancer. Their cancer outreaches have impacted over 50,000 Africans, providing awareness, free screening, and treatment. Okay, Mr. Victor Ekpo, we now give you the floor for your presentation.
Yeah, thank you very much. I'd just like to confirm if everybody can hear me.
Yes, we can hear you.
Yeah, we can hear you.
Okay. So I'd just like to share my screen, but I'm not sure if that's possible. Is that possible to do?
Okay. Is it ready? Can you
Okay,
show
let me
me?
try again.
Okay, thank you.
Okay, I just want to confirm if you can see my screen now.
I can see your screen, sir.
Oh, perfect. So basically, I'll just give you a brief rundown of what my medical physics education has been like. I started in high school, and originally I always knew that I wanted to be a science student. So science was always the main subject for me. I was either going to be a science or an engineering student. Just to give you a breakdown for what it was like for me. During my science secondary school, I had A's in mathematics and physics. And so I always knew that my interest would be in physics. I went on to study, first tried to study electronic and computer technology at the university. But I didn't quite like studying IT per se, especially that this was a new course in that school and it wasn't as interesting for me as I thought it would be. So I had gotten out of school and then gone back to seek admission for a BSc physics program. So I did BSc physics for 4 years. And after doing BSc for 4 years, I found out that I liked physics a lot. And it was something that I did very well. So I was quite interested in doing that. Physics was a very interesting topic for me. It's when I started doing physics that I actually found out about medical physics. Prior to that, I didn't know so much about medical physics. So it was just in the course of doing a physics course that I now heard that there was a course called Medical Physics, a lecturer who had, Professor Yang, who had just come back from South Africa and I studied medical physics there. So medical physics basically was the application of physics in medicine, especially the safe use of radiation. So I checked everywhere I could find to try and see if I could do medical physics because I couldn't do it in the university that I was in. So sometimes the challenge in doing physics is always that you want to try and do something practical and that's something that you can apply so that you don't just read or solve equations without solving a real problem. So that's usually the challenge. But medical physics gives you an immediate application to solving a problem. So I always talked about what are the major physics problems in the world right now. And these are the three major physics problems in the world. The world is still grappling with better ways to produce power. So we're hearing of solar energy, wind energy, finding more efficient ways to do that. And then there's the issue of space exploration, trying to find out what is beyond the Earth, Mars, outer space, what's really there and what can we use it for. But cancer is really the real life-threatening thing for everybody else. So cancer seems to be right in the middle of what the biggest challenge is in the world. The world has found solutions to a lot of diseases, but cancer is still a major problem. We've not yet fully found the solution to cancer. We still don't know exactly what the cause of the disease is, and we still don't know exactly how best to treat it once and for all for some cancer diseases, So this is basically what my pathway has been like. After my BSc, I still did not go on to study physics immediately. I went into working first. I got a job in the bank first before I got a scholarship to go to London to study wireless computing. After then is when I did my master's. So I have two master's degrees, one in wireless computing at the University of York, UK, and the other one at the University of Lagos, Nigeria, which is the medical physics degree. After I finished my medical physics degree, I went on to do internship. When I finished medical physics, there were no good cancer centers in Nigeria. So I had to go to Ghana to look for where medical physics was applied at the best levels. It's after I had gone through my internship process that I now work at Medical Physicist, the ASI Ukpo Cancer Centre. So what is really required for medical physics? Medical physics is a combination of knowledge, passion, and skill. You have to be knowledgeable, understand how these things work, how radiation works in particular, the interaction of photons with matter, how that plays out. So you begin to understand the interaction of photons with the body. Once you understand with matter first, then you understand how it interacts with the body, how it interacts with soft tissues, how it interacts with bony structures or with bone. You have to be passionate about it. And then you have to develop the skill. So medical physics itself is a skill. The best way to learn it is to practice it, to stay on the job, to sit on the system, to try to optimize your plans. So you have to sit there and learn it. So there are a few things that have helped me in my career. I've always had a relentless principle to maximize my potential. I've always wanted to be the best at whatever I do, to never settle for less. I've had a very good crop of mentors, people that have pushed me. I've always gone around to ask a lot of questions. So before I did my medical physics degree, I went to one of the hospitals where medical physics was practicing. And I had to ask him a lot of questions, how best the practice works for him, and whether it's an interesting thing to do at all. So it's something that needs to be done. You have to ask a lot of questions. I think the beautiful things about physicists is that we understand that nobody will know everything. So we should always be able to ask questions. If you don't know something, you can always say that you don't know it yet and that you are willing to learn. So, and then find a way to understand that whatever problem that you're trying to solve is a global problem. It is not just unique to where you are. Cancer is a very big global challenge. It's affecting a huge number of people across the world. So there are some things that I would like for us to consider. So what you can do if you want to become a medical physicist is to, one, volunteer your time in a cancer center or a cancer foundation. So like you heard in my bio, I'm executive director of Pink Africa Foundation. So that helps me to interact more with cancer patients when they are first diagnosed, or even we may be the first people to see them. So every week we come across women with breast lumps, for instance. So even though most breast lumps are benign means that they are not cancerous. But the 1% or the 10% that is cancerous, we are able to pick them on time and to encourage them on how to get treated. So that's one of the best ways to start your career. You have to be willing to ask a lot of questions. Always ask questions. Always be inquisitive. Figure out how best you can do something. You have to be passionate about improving patient care for cancer patients. You have to be very passionate. You have to show a level of interest, to be empathic. Most cancers are caused by things that we do not know yet. So apart from very few cancers, most of the cancer patients that I've met, they do not smoke, they don't drink heavily, they are not into, they do not necessarily have multiple sexual partners. So you have to be empathetic. Most cancer patients have done nothing wrong to have brought the cancer upon themselves, at least to the best of our knowledge. So you have to understand that it's something that can happen to anyone, and as collectively we can find a solution to it. Okay, so that's basically what I would like to bring to the fore. And then I'll entertain some questions. You can ask me any questions about maybe what a typical day as a medical physicist, and I'll be willing to answer. Thank you very much.
Thank you for your time, Victor Epto. We really appreciate it. I don't know if someone have a question to do.
Okay, I have a question. Well, thank you for the meeting, Mr. Ukpo. I have a question about the definition of medical physics. You say that it is main focus on radiation, but there is another topic similar apart from radiation. I heard some about, for example, it's something similar like biomedical engineer.
Yeah. Okay. So biomedical engineering is kind of a different course. That is an engineering thing. So engineering, for instance, says that if the machine gets bad, that the engineer is going to repair it. So in the clinic, we have five groups of people. So we have the doctor. The doctor is the one who gets to see the patient and decide that the patient needs radiation to treat the cancer, right? So we have the doctor. We have the nurses. The nurses, if a patient has a wound, the nurse would dress the wound. If the patient has to take chemotherapy is the use of drugs. A nurse would administer the chemotherapy. It's like a drip for some of them. So if it's a drip, the nurse would administer the drip. If it's so we have the nurse. We have the pharmacist. The pharmacist is the one that dispenses the drugs if it's chemotherapy. So then we have the medical physicist. The job of a medical physicist at the beginning of the day, the medical physicist is the one that certifies that the machine is safe to use, right? So we have when we get to the office, the biomedical engineer will put on the machine. So I'm trying to walk you through what a normal day is like. The biomedical engineer will put on the machine, and the machine has come on. But the linear accelerator has to be warmed up, and there has to be a daily QA. The QA is like daily quality assurance. So what a medical physicist does is that we carry out certain tests to show that the machine is safe to use for that day, right? The machine is safe to use. So we check that, for example, that the machine is releasing 100 centigrade every time that we want to get 100 centigrade. Centigrade is like a unit of measurement, right? So that is the medical physicist's role for that patient. So that's one thing that the medical physicist does, not the engineer. The engineer will just put on the machine, check that the water is fine, check that the gas is fine, check that the engineer is almost like a car mechanic, right? But the medical physicist checks that the output of the machine is accurate. Also, for every single patient, the medical physicist also checks that, also does a treatment plan. So let me see if I can show you what a treatment plan looks like. One second, so that I'll just need to show you what it looks like. Gives you an idea of what the job that we do is. So I'm sharing my screen again. So this is a patient's treatment. The patient is being treated for cervical cancer, right? So this is CT images. And in these CT images, you can see, I'll just show you something. So this is like the spine of the patient. I don't know if you can see my mouse. I'm not sure whether, can you see my mouse?
Yes, we can see.
Yes.
Okay, so this is like the spine of the patient. These are bones here. And this part that is having a color gradient is where we want to treat, right? This is where the cervix of the patient, that's where the cervical, that's where the cancer is. So this is where we want to treat. This is the bladder of the patient. And this is the anorectum of the patient. So the anus and the rectum of the patient is here, right? So we have to make sure that we are going to give radiation only to this part and not to give so much radiation to the bladder or to the rectum, because we want to treat the cervix. So this is the role of a medical physicist. So you do that by, in this case, we are using a very advanced tech, so it's called a VMAT. So you see, it's a 360-degree arc, and then these are multi-leaf collimators. And then at the end of the day, you want to make sure that your target, it's the one that extends to the very end here. So it's somewhat complex. So there's a complex plan, but it's somewhat complex and it's somewhat interesting. But this is what the medical physicist does. The medical physicist ensures that in the treatment of this cancer, that the normal organs do not get as much dose as the cancer cells. So we take our time to analyze, to say we want to give 50.4 gray to that organ, and then we do a lot of quality checks, and then check that the rectum is not getting too much, check that the bladder is not getting too much, check that the bowel bag so that the patient doesn't come down with diarrhea, right? Check that the head of the femorus, of the femur is not getting too much. So these are quality checks. So that is basically the role of a medical physicist. An engineer an engineer is an engineer. He just repairs the machine if it's bad. He checks that everything is, that the AC in the room is fine, that the machine has been turned on. Anything mechanical an engineer will do. A physicist ensures that the machine is of the highest quality for treatment. So biomedical engineer is a wonderful course for anybody that wants to be an engineer. But this is physics now deals with. When you're doing physics, you have to do a bit of anatomy so that when you look at an image like this, you get to understand what is what, you know. Thank you.
Thank you. It's very clear now the difference between these areas.
Yeah.
I have a question, and
Okay.
well, actually two questions. One of them is, I'm a little bit scared on how difficult is to see patients every day, because the cancer treatment is for childs, women, men, old persons. I can, well, I would like to know how much difficult is to the work of the medical physicist in like in that part, specifically in the clinic.
Okay, so it depends on you. I don't know if you're referring to the emotional aspect of it. I don't know if you're referring to seeing a patient in pain and figuring out whether you can help the patient or not. But if that's what you're referring to, it's complex. You would have a patient that you try to help as much as possible. I think that's the idea. I think I'll feel worse if I see a patient and then there's nothing I can do, you know. But we always try to look out the positives, look at the good side, the ones that you help out, you know. It's some patients will come very late and some patients will come early. So that is why it is also important to be a cancer advocate and not just a medical physicist. As a cancer advocate, you're trying to make people aware that if you come to the hospital on time, you have a very high probability of survival. So for instance, let me give you an idea. Stage 1 breast cancer. The survival rate for stage 1 breast cancer is almost 99%, right? So if a woman presents to the hospital, so cancer is in stages 1 to 4. Stage 1 is very early, and stage 4 it's late, or sometimes it can be too late, but stage 4 can be really, really late. So stage 1 is when we prefer to see the patient. It's better that as soon as the patient sees the symptom, the patient presents to the hospital. So as a cancer advocate, you are trying to let people know what the possible symptoms of breast cancer is. For instance, you start advising people that if you see a lump in your breast, go to the hospital. Don't wait until the lump becomes a wound, because that's when it's going to be more and more difficult. If your lump starts becoming a wound, and then the lump, the cancer now spreads from your breast to your maybe brain, or to your spine, or to your lungs, that is now becoming difficult. So that becomes more difficult to treat. However, even for stage 4 cancers, the survival rates are still maybe 25% or thereabouts. So very few people come that there is nothing you can do at that stage. But even for some people, they still have a chance of survival if they are properly treated. So we always try to do the best we can. And so it is important that even as medical physicists, we are at the top of our game, that we try to learn to do the best, be the best, so that if someone comes across us, that they are getting the best quality of care. And that's basically what I think is the most important thing. Just to try to see if we can help every cancer patient that needs radiation therapy and passes through to you. So we've had very good success stories for. There's a girl that came to our cancer center that she could barely talk or walk or even move her neck, and by the time we finished her treatment, she was very strong and going forward. So it's just positive cases that we look to, to encourage ourselves that this is something that we need to keep doing, and to get involved in research and try to see if there are better ways that we can do it, so that everybody that comes to us can get a cure. Thank you.
Thank you. Well, the other one is like the motivation that you have for do extra works out of the medical physics work that you have. For example, be the executive director of Pink Africa Foundation, and well, different things that you do, trying to do better things for cancer patients. What is the motivation? What is the thing that we need to do the same? Because we could be medical physicists, but I would like to do extra works, or give extra of my time to do the best for the patients.
Yeah, so think about it as a global problem. The whole world is grappling with cancer. And sometimes the way I look at it, we've been blessed with all of this intellect, all of this knowledge. We've been blessed with the best of education and everything. And just doing our work sometimes is not sufficient, And like I said before, you also want to be able to see your patients come in early when they are at the early stage of their disease. And as a medical physicist, you may not be able to do that. You may just be able to treat only people that come to you. So the only way that you can now ensure that people come to the hospital early is to volunteer in all of these other outreaches, to take the word out there that cancer is not a death sentence. In our culture, in Africa here, our biggest challenge is that people are too afraid to be treated. And people are too afraid because they have not heard many good news about cancer patients. So they are too afraid. They don't want to, they don't even want to come to the hospital. When they hear that they have cancer, they either think that they are going to die or that modern medicine does not have a solution for them. So the only way that we can cope that is to show positive stories of people that had cancer, people that got treated, right? And people that are surviving after their treatment. So if we have these good role models, then more people will be willing to come to the hospital, right? So if one of the things that we did in the last 2 years is called Pink and Press. We have a support group for breast cancer survivors. So that as soon as someone sees a lump and then is diagnosed of breast cancer, we can tell you that there are hundreds of women that have survived it and that you can talk to any of them, because for a cancer patient, talking to another cancer patient can be very life-saving for them. Let them know that somebody else went through this and the person is surviving. So that's basically our motivation, to use the best of our abilities to do the best of the things that we can, to understand that our people should not necessarily die needless death. You know, the main reason people do not want to come to the hospital is that they don't know somebody else who has survived, and because of that, they do not trust modern medicine. Because in the movies, once someone has cancer, the person is almost dead. You know, in the movies. The movies are where if someone has cancer, you know that the person is about to die, they'll start telling you how many months the person has left to live. You know, but there are so many positive stories of people that got treated, people that survived, people that have done well after their treatment. So it is our responsibility. It is our own responsibility to showcase that, so that our own people do not get to die in death that is not necessary. You know, cervical cancer, for instance, is now almost curable, right? Cervical cancer has a vaccine. So there's HPV vaccination. If someone takes HPV vaccination when they are, even before they are sexually involved, so when they are teenagers, maybe between 9 and 14, their chances of having cervical cancer is less than 10%, right? So you reduce that chance drastically, you know. So if you can make them know, okay, your daughter should take HPV vaccination so that you don't have cervical cancer. And then if she eventually has cervical cancer, maybe for those that didn't take when they were younger, there is a radiotherapy. Radiotherapy is very, very effective now for cervical cancer. So if there's radiotherapy, the person has radiotherapy, has concurrent chemotherapy for 5 weeks or so, the person is almost good to go, you know. So the survival rates are very good. So we just need more people to step up and talk about these things and to let the people know, you know, and we can ask someone else to do it, but it's our responsibility to let people know that people are surviving. And if people are surviving, then the person that just got diagnosed can also survive. And if they can also survive, then they can consider making the treatment for cancer, because cancer is very expensive to treat, right? It's very expensive. So you have to think the person is probably thinking, is it necessary for me to spend all this money if I'm still going to die? You know, but if you tell the person, if you spend all this money, you are going to survive, or you have a high probability of survival versus not doing anything at all, you know. So it's our responsibilities to do that. Those of us that are in the field, that have seen better, that know better, we have to ensure that our people also know the same things and to provide the best care for them. Yeah, thank you. I hope I answered your question.
Okay, we have another question from Alessio Guillermo. He's asking about the simulations of medical physics. You show,
Yeah.
example, an image of a part of the body. He wants to know, for example, what kind of programs experience in this, in simulations, in programming, in medical physics.
Okay, so there are several ways to. So let's talk about your training in medical physics, for instance. I think you are all doing a BSc in physics degree now. So in most countries, you'll be required to do a master's in medical physics after your BSc. So I don't know if in Peru they have a master's in medical physics program, but I'm sure most countries do, right? Do you know if there's any master's in medical physics program in Peru?
Yes, there is a few. I think there are two in two universities, but these programs in masters are very new. They have a few
Okay.
years.
Okay, so most people go to this international certification. So once you finish your master's in medical, I'm just trying to check which school has it. It's Kauno Technology Jos Universitas, KTU. So there's a master's in medical physics is that Peru?
I'm not sure.
No?
I don't think so.
Okay. So I'm sure that there are masters in medical physics programs in Peru. If there are no masters in medical physics program, you can check for maybe universities that are close to your country and attend a master's in medical physics program. There are also opportunities to attend internationally. The ICTP in Italy also organizes a master's in medical physics program. I think it's a 2-year program. So medical physics is just a 1 or 2-year program, almost everywhere in the world. So that's something that you can do to get into medical physics. If you have any difficulties, you can reach out to me, and then I'll figure it out for you. There's also, after that, you can get internationally certified. So personally, I've also written the what do they call it now? There's international certification in medical fields that you can write, basically, So you can write this, and then you'll be allowed to practice anywhere in the world after you've done your medical physics program. There's also opportunities for simulations, for research. In fact, once you're in the medical physics field, you have to be involved in research. Like I said earlier, cancer is still a very mysterious disease. So there's any area of research that you go into that concerns cancer is still very highly sought after. People want to, including AI, finding ways to automate things to simulate different situations. So if we can go into research, there are so many opportunities for that, including in AI. There's research for CT, there's research for MRI, there's research for treatment planning. Treatment planning is what I showed you earlier in that cervical cancer case that I presented. So there are opportunities for all of that. So it's something that you can look at and find a way to get involved in.
Okay, I have a final question. In my case, my final question. It's about, you comment 3 main research areas in physics or applied physics. This is the cancer, the space exploration. I don't really remember the last one, but we are going to focus on cancer. Oh. Sorry?
Yeah, I didn't get that. Sorry. Let me see if I can find it.
Okay. Well, it's about cancer. For example, what are the what are the main objectives or challenges in this area on cancer? And what is the current perspective on this matter in the world, in the area? You can comment this.
Okay, so I was talking about these three major areas: sustainable energy, space exploration, and cancer. Those are the three things that the world is raving about in terms of physics, problems that physicists should be able to solve. In cancer in particular, so it is about the best use of radiation now. There is nanoparticles. That's a huge area currently for most people. It's nanoparticles, the use of particles to treat cancer and how effective that can be, right? There's also AI, the use of artificial intelligence to even to detect cancer, you know. We are trying to see if there are better ways for us to detect cancers on time, to detect also the biology of the cancer. For instance, breast cancer has like 3 or 4 types. So we have HER2 positive breast cancer, we have ER positive breast cancer, we have PR positive breast cancer, then we have triple negative breast cancer. So you have to be able to find better ways to do this immunohistochemistry and to be able to do it on time. You know, we're even trying to research the cause of cancer. What is even causing cancer in the body? What is that thing that is triggering itself to become cancerous? You know, so the areas of cancer are so vast. We are trying to, so there's a diagnosis part, there's the treatment planning part. The treatment planning part, very important. How can we deliver treatment faster? And then there's the alternative treatment part. The alternative treatment part tells us, apart from radiation, what else can we add to it? Can we do nanoparticles? Can we do laser or any other thing in addition to the radiation therapy to improve it? Currently, we are using, a lot of centers across the world are using photons and electrons. However, there's a lot of research going in with the use of proton for radiotherapy, and some centers are already doing that in the world. Very few. There's the use of heavy ions and light ions. So we have carbon ions, for instance. So there's the use of carbon ions in the treatment of cancer. There's the use of neutrons in the treatment of cancer. These are still a lot of research areas. So there's proton therapy, neutron therapy, light ion, radiation therapy. Those are all areas that need to be explored. So there is still a very vast area. In treatment itself, even when you're using photon, there's the area of adaptive radiation therapy. So adaptive radiation therapy says that you start treating the patient, but the tumor has gotten smaller. So as you're treating, the tumor is responding and it's getting smaller and smaller. And you have to find a way to collimate your beam or to narrow your beam according to how the tumor is shrinking. you know. So that's like adaptive radiation therapy. So the areas for cancer therapies is really, really vast, and whichever area that you go into, cancer is still a very green area. Anything you do will really improve the quality of life for most patients. Okay.
Okay, thank you very much. Well, anybody have a question?
Well, I have the last question.
Okay.
In that way, for example, in in the intelligent artificial applied to medical cases and the treatment or detecting the cancer early, is it's necessary to study computer science, or maybe in the master's degree of medical physics, someone could work on that, or it's necessary have a degree in computer science, intelligent.
No.
Or
No. You don't need to have a degree in computer science, really, you know. But I think that every single thing that you learn is going to be important for your work, you know. I have a degree in wireless computing before now, and I always say that it's important for it comes into play in very subtle ways. You know, our treatment planning system, it's computer based, right? So as much as you do not necessarily need it, right? You do not necessarily need to do computer science to know how to treat the patients. It helps because what most of the things that you are doing are basically computer-based things. So all of this is done in front of a computer, right? So it helps you can learn software languages and all of that, and maybe you find better ways to code, you know, certain things and make it work better, because these are all computer algorithms that are being used. So maybe your knowledge of it would help, but you do not necessarily have to go back to school to study a master's. You can just learn it online on your own, you know. I'm involved in a lot of things, even graphic design, for instance. So I learned graphic design on my own, and something as simple as that helps us to organize events for outreaches, you know. So every single skill kind of helps. Every single bit of it is useful for your practice. No knowledge will be lost. You know, somehow you get to apply these things, but you do not have to go back to school to study computer science. You can try to learn Java by the way, right? Just try and learn it on your own, but you don't need to, you don't need to know it to practice. The things that you need to learn eventually, for instance, is anatomy. But that will be taught to you in your master's program, and then you can also learn as much of it as possible on your own. Understand those things, yeah. And then there's a statistics course in during the masters as well. So you get to learn all of that. So you don't need any other degree. I think medical physics is probably the easiest possible degree to do in your master's, really. It's easier than quantum physics, it's easier than nuclear nuclear physics. It's easier than solid state physics. Medical physics is the easiest one, right? Because you can go to the hospital immediately and implement it. You don't need to be implemented here. So it's the easiest one. It's a very simple course. It's a very simple course. If you are good in physics, you should be good with medical physics. The amount of anatomy that you need will not also be too much that it will bore you to death. You just need a little anatomy. You are not doing a surgery per se, but you just do like basic anatomy to get to understand what you need to do. So you don't need to. You can learn it on the side, but don't try to do another bachelor's degree or master's degree in computer science.
So in your medical physics master degree, did you learn all about the things about the anatomy of the body to works in like medical physicists?
Yeah. So you have to learn about anatomy. So basically, it's basic anatomy that you're learning, right? You learn basic anatomy and what they call radiation biology. What causes cancer? How the body responds to radiation, right? And how each of the body structures are placed. So basically what you learn is something like saying, let me go back to that slide again. What you learn basically is this one. So what you learn basically is to be able to say that this is lateral to this. The bladder, for instance, is superior to the cervix, and the cervix is superior to the rectum. Those are the basic things that you learn, right? And then throughout your practice, there are so many training courses that you have to go to. So it's not like you even learn everything at once. Throughout your practice, there are so many things that you would have to do to continue learning about your anatomy. It's never ending. You'll keep learning about it till much later in your career. And even doctors keep learning about anatomy. So it's a continuous learning process. Every day you learn something new. If you are not sure, you can either ask any senior colleague, or you or you check online and you find solutions. So it's a continuous learning. The anatomy that you'll be asked to learn, they won't ask you to learn. It might not be the entire circulatory system, for instance, but you just have to know, for instance, how the blood vessels flow. It just gives you a good idea. I'll show you. So, for instance, let's say that what you can learn, for instance, there's what is called prono. I'll write it on the system. You can check it out, and then it will give you an idea of different contouring. So this is one of the very important tools for you to learn each of the structures of the body. But it might still be too early. After your medical physics program, you can look at it and see. There are so many tools online to learn these things, and they are quite, trust me, medical physics is very, very simple. It's the simplest part of physics. It's just to develop an interest I'm going to.
Thank you.
Okay, well, thank you very much, Mr. Victor Ekpo. I apologize if my English was not good,
No, it's
but
good.
I tried.
I
I
wish
tried.
I wish my Spanish was good too. I would have loved to speak, but my Spanish is I don't have any knowledge of Spanish at all. So you're doing very well.
Oh, thank you very much. I
Yeah.
have to have this. Thank you for your time. It was a great presentation. We learned about a lot about this area, metaphysics. We cleared our ideas. We solved some questions. It was a beautiful presentation. Thank you very much, Mr. Victor Ekpo.
Thank you so much. I appreciate this time. I look forward to seeing all of you studying medical physics in the future. Maybe one day I'll come to Peru and see all of you. It'll be nice.
It can be a good idea.
Yeah,
We
it
have
would be nice.
Yeah.
Thank
Thank
you.
you.
Thank you so much for your time.
Yeah, you're
Thank
welcome.
you very much. Thank you for the attendance. Well, this was our meeting about. Eso fue, ¿no? Bueno, gracias por
Ya
atender.
salió.
Ya, bueno, gracias por estar presentes en la charla. Espero que hayan podido entender. Como verán, es muy importante el inglés.
Sí, chicos, el
Así
inglés,
que si no
así.
entendieron, igual creo que lo vamos a subir a YouTube. Creo que ha sido una charla bastante interesante, la verdad. Creo que es bastante experto el señor Ekpo. Creo que tiene una mayor perspectiva comparado, creo que los físicos médicos de acá en nuestro país. Creo que sabe bastante de las áreas actuales de investigación y los retos que se tiene en esas áreas, ¿no? Así que sí, sí, hay que entender inglés. Yo también, o sea, entendí, no todo, pero por partes, no lo principal. Pero igual hay que seguir practicando inglés, es importante. Como hayan visto, tienen que ser bastante cuidadosos con lo que dicen. Pueden en YouTube con subtítulos, ya bueno, te encargarás de subtitularlo. Tienen que ser bastante cuidadosos con lo que dicen en inglés porque puedes decir algo y que tú pienses que esté bien, pero en inglés él lo escucha bastante rudo y lo puede tomar a mal, ¿no? Yo también bastante preocupado por decir las palabras correctas y no ser bastante unpolite, como se dice, ¿no? Pero bueno, muchas gracias por su atención. Tuvimos algunos problemas de coordinación porque, bueno, como el ponente es de Nigeria, allá son 6 horas más. Así que ya están a madrugada, pues se fue seguro rápido a dormir. Ya
Sí.
la siguiente charla, no está seguro si la haremos presencial o virtual, porque creo que me parece que las presentaciones de tesis son la otra semana, jueves y jueves y
Sí. Lo voy a banear ahorita.
sí, sí, jueves y viernes, así que lo estamos viendo. Creo que la siguiente es mía, ¿no? Mía, ¿no? Me toca a mí, ¿no? La siguiente.
Sí, sí, amigo, la siguiente semana tienes tu expo.
Será un poco, trataré un poco hacer más, es acerca de mi proyecto de tesis, pero voy a tratar de hacerla más digerible. No tratar de enfocarme demasiado en las partes matemáticas, solamente colocar los resultados y comentar acerca, ¿no? Es acerca de reactores nucleares, una parte que se llama moderación, pero ya la conocerá un poco la siguiente semana, ¿no? Ya coordinaremos si será virtual o presencial y lo avisaremos. Muchas
Ya.
gracias. Yo también me voy.
Ahí nos vemos, chicos, cuídense. Gracias a todos. Bye.